Common conditions. There are many common oral conditions that can contribute to poor oral hygiene and pain. It is important to assess oral health on a daily basis in order to identify any problems or concerns. Conditions such as dry mouth or cracked lips can occur frequently and can create issues with eating, swallowing, and communication. Know the patient's abilities. Can they swallow properly? Can they drink fluids? Can they brush their teeth, or do they need someone to help them? Can they spit or expectorate? Answers to these questions will help determine what oral care tools and supplies are needed. Include these resources in the patient's oral care toolkit to have available for daily oral care. Having the right supplies on hand saves time and improves care. Dry mouth and lips. Dry mouth and lips are very common in frail elderly and palliative care patients. Causes. As many as 400 different medications can cause dry mouth. Disorders such as diabetes, Sjögren's syndrome, psychogenic disorders, or idiopathic disorders can all contribute to dry mouth and lips. Mouth breathing causes dryness of the gum tissue and mucosa. Dehydration also causes dry mouth and lips. Symptoms associated with dry mouth include difficulty swallowing, chewing, and speaking. It can also cause bad breath or hoarseness. Difficulty swallowing often results in poor nutrition, and reduced fluid intake causes dehydration. A dry mouth is an optimal breeding ground for plaque and bacteria. This can lead to increased tooth decay, gum disease, and burning mouth syndrome. Treatment. Prevention of dry mouth can be as simple as drinking water or sucking on ice cubes. If appropriate for the patient, sugarless lemon candy or sugar-free gum can increase saliva production in the mouth. When dry mouth is a result of medications, asking the patient's physician to prescribe an alternative medication may be an option. However, often this is not possible, and treatment of the symptoms is required. Saliva substitutes are available commercially, and a pharmacist or dental professional can help assist with choosing these products. A room humidifier may also be useful to moisten the air for mouth breathers. Candida infection, also known as thrush infection. Candidiasis is an opportunistic fungal infection. This type of infection can cause a fungal overgrowth to accumulate in the mouth, usually on the gum tissue, tongue, and soft palate. Causes. It most often occurs when the body is run down and not functioning properly, as is often the case with palliative patients. Patients who are on antibiotics, immunocompromised, receiving chemotherapy, or diabetic are at the highest risk for this type of infection. Other risks for Candida include improper denture care. If dentures remain in the mouth for extended periods of time, underlying tissues are not able to be cleansed naturally with saliva or by brushing and rinsing. It is important to remove dentures every day to rest and cleanse the tissues, and to allow dentures to be cleaned thoroughly. Dentures cannot be cleaned properly unless they are removed from the mouth. Dry mouth and certain medications can also trigger Candida infection. Symptoms. This condition appears as white creamy patches or small red dots. It is usually not painful. Sometimes the underlying tissue is quite raw and may even bleed. Treatment with an antifungal agent is possible, but must be prescribed by a dentist or a doctor. Make sure to disinfect or discard any oral care tools that were exposed to the infected tissue. Soak dentures in a solution of vinegar and water to eliminate any cross-contamination. Dentures that don't contain any metal can also be disinfected by soaking them in a mild bleach solution, 1 part bleach to 15 parts water. Denture stomatitis. Stomatitis refers to any inflammation of the mouth tissues. Denture stomatitis is the most common form of chronic stomatitis. Causes. This generalized inflammation is often caused by candidiasis forming under dentures. It is usually found on the palate of partial and full denture wearers. It is most common in women who refuse to take their dentures out at night before going to sleep. It can also be caused by ill-fitting dentures. Some people believe this condition is caused by an allergy to the denture material, but there is little evidence to support this. Symptoms. There are 3 stages to denture stomatitis. The first stage presents as red pinpoint dots on the palate. This progresses to erythema. And finally, hyperplasia, which is noted by red nodules appearing where the denture would sit on the palate. Sometimes there is tenderness associated with inflamed areas. Treatment. Taking dentures or partial plates out for a minimum of 1 hour every day will rest the tissues. Ideally, dentures and partial plates should be removed at night. It is important that the dentures be thoroughly cleaned every day. Angular cheilitis. Angular cheilitis is a chronic painful condition that occurs in the corners of the mouth. It is most commonly seen in people who have lost some or all of their teeth. Causes. It can be associated with poor nutrition, a fungal or bacterial infection, and commonly occurs with constant licking, drooling, or pooling of saliva. Symptoms. It appears as red and ulcerated patches in the corners of the mouth. It can be very painful to open the mouth and can limit eating, drinking, or speaking. Treatment with antifungal agents and changing the patient's dietary habits to improve overall nutrition can help alleviate the problem. Taste disorders. The sense of taste and smell are so closely linked that people who can't smell often complain that they can't taste anything either. Taste buds are located at various spots on the tongue, and olfactory or smell cells are specialized cells found in the nose. They both depend on zinc and other nutrients for their growth and maintenance. Causes. The efficiency of these 2 senses can decrease with age, but changes can also be due to viral infections, head injuries, cancer therapy, or side effects of prescribed medications. Symptoms. Some people may develop disturbing sensory changes such as a metallic, bitter, or salty taste that can occur by itself or be triggered by foods or certain medications. Heart medications and diabetic medications can cause a decrease in the taste sensation of salty or sweet foods and can also cause burning mouth syndrome. Medications for Parkinson's disease can cause the food to have a metallic taste. Antidepressants can cause dairy products to taste rancid and other vegetables and fruits to have a chemical taste. Treatment. Some helpful options to improve the loss of taste and smell include eating foods with higher taste sensations, using artificial saliva substitutes prior to eating, using fluids like gravy and light cream sauces to increase the fluid of the food and give it more taste. Swallowing disorders. For palliative patients at the end of life, swallowing is often a problem. Causes. Although there are a variety of causes, sometimes it's simply due to lack of saliva in the mouth. If swallowing difficulties are the result of stroke or advanced Parkinson's disease, having a dry mouth and throat can make the problem even worse. As described earlier, dryness in the mouth can be caused by medications, mouth breathing, or other disorders. Symptoms. Normally, the tongue provides the pushing movement that moves food towards the back of the throat. With a swallowing disorder, the tongue loses control and cannot move the food properly while chewing. There is also reduced use of the facial muscles, and the mouth and lips cannot close properly, making it more difficult for the food to be swallowed. Loss of sensation in the mouth makes it difficult for the patient to know there is food left in their mouth, and this usually ends up causing pocketing of food in the cheeks or under the tongue. To prevent the patient from choking, food must be removed by the care provider. Treatment. Chewing and swallowing food is improved in the presence of saliva and moisture. Therefore, treating dry mouth as described previously may help with swallowing. Ensuring that food is moist is also important. Sometimes patients will need to have their food pre-blended to make the food particles smaller and more manageable. In a hospital or long-term care facility, a suction machine may be required to remove the food debris from the cheek pouches and under the tongue. Wrapping a thin face cloth or gauze around the finger and sweeping the tissues is an option for cleaning food debris when suction isn't available. Chronic dehydration. Dehydration for palliative patients and the frail elderly is a significant problem. Some reports suggest that as many as 30% of long-term care residents are chronically dehydrated for a variety of reasons. The physiological mechanisms that control the thirst reflex may decline or be inhibited as a side effect of medications. Urinary tract dysfunction can be painful and may reduce the intake of fluids. Elderly patients with dementia may have decreased fluid intake. Care providers may need to monitor fluid intake to ensure that residents are not at risk for dehydration.